everyone, and thank you so much for tuning in to Carly B TV. I'm Dr. Carlicia Booz. For this Wellness Wednesday segment, we're going to be talking about gallbladders. Gallbladder plays a major role in the digestive system, and this morning I'm joined by Dr. Thomas Woodyard. He's with the Collison Medical Center. So good morning, and thank you so much for joining us.
Thank you.
All right, so Dr. Woodyard, can you just tell us what is gallbladder and the purpose of the gallbladder?
The gallbladder stores bile to assist with digestion. It doesn't store all the bile, but it's when people eat a meal, it gives a little extra oomph to help digest the nutrients that have been ingested.
Okay, so how common are the gallbladder issues that some people are having? I'm hearing that it's very common that, we're having a lot of issues in the gallbladder.
It's really become very common even between when I was in training and now. It's so common that many patients are diagnosing themselves based upon colleagues and friends and family that have had the same symptoms. And they're like, oh, that sounds like your gallbladder. You better go see your doctor. It's becoming very common.
So what are some of those symptoms?
People will generally have pain or nausea or both in their upper abdomen or under their right ribs. Oftentimes it goes around back to the shoulder blades. Usually it's associated with food. And it usually lasts more than a few minutes. It'll last hours or sometimes even all day.
Oh, wow. So what tests should a person undergo to determine how serious the gallbladder issues are?
The main test would be an ultrasound. It's the best test for looking for gallstones. A lot of ERs will get a CAT scan first, which can sometimes show gallstones, but it's not the best test for showing gallstones.
Okay. So is there a surgery or anything for treatment when it comes to having issues in the gallbladder?
Once people have symptoms and have gallstones, it's recommended that they have surgery. It's a very common surgery. It's done laparoscopically for most patients, and it's an outpatient procedure. They go home that day. Most people with office type jobs will take a week off from this. Full recovery is about 2 to 3 weeks.
Okay. So with this recovery, so are they able to, obviously they have to stay at home. You say about 2 or 3 weeks. So is it, they have to stay out their feet? They have to lie in bed. What are some of the things they have to do during recovery?
Actually, we pretty much let them eat what they want and walk around as much as they want. I ask people to not drive a car for a week, but they can get about and do their lives. And some people working from home are working the next day from home. So we don't tell people to stay in bed, and we just don't want them doing a heavy yard work or heavy lifting. They can break open their incisions. But other than that, they can pretty much get back to their lives fairly quickly.
Okay. Now you did mention it's a laparoscopic procedure. Have you seen it where, some people can pass away from gallbladder? Is it rare from gallbladder issues that, there's death associated with those issues?
There can be, and that's why the recommendation is once people have symptoms to go ahead and get it taken care of before it gets bad. But yeah, there are some bad cases of gallbladder infections and gallstone pancreatitis or common bile duct stones causing an infection called cholangitis. Those can be fatal. Those can be very serious.
Last question. So what about some people that don't have symptoms? How are they? Is it usually caught at their regular checkups? So would you encourage people to just do regular checkups just to catch it if there's no symptoms?
The current recommendation is that people with gallstones and no symptoms do not need to have surgery. I make an exception to that. I think any woman who wants to get pregnant, even if they don't have symptoms, probably should have a discussion about getting that gallbladder out before it becomes a problem in pregnancy. But for most people, the recommendation is gallstones with no symptoms get watched. And as soon as they have symptoms, then take it out.
Okay. Well, thank you so much for coming on the show today, Dr. Woodyard, and I really appreciate it.
Thank you.
You're welcome. This concludes our Wellness Wednesday segment.
Hey, are you experiencing algae, mold, dirt, or pollen around the foundation of your home and your driveway? If so, call Reed's when you're in need. Reed's Power Washing Service has next day service available. Select service less than 2 hours. You're thinking, Reed's Power Washing Service is homes, that's all we do. Nah, we do it all. Driveways, fences, porches, and we clean your rides. So call that number on your screen today and get you a free quote.